IV cannulas. Sizes, flow rates, uses, and parts of cannulation. Definition. IV cannulas are hollow tubes inserted into veins for intravenous administration of fluids, medications, or for drawing blood. Purpose: to ensure a secure and controlled route for intravenous therapy. IV cannula color coding and size. Color coding indicates the gauge, diameter, of the cannula. Common color coding system: pink, 20 gauge 0.9 mm diameter. Blue, 22 gauge 0.7 mm diameter. Green, 18 gauge 1.2 mm diameter. Orange, 14 gauge 2.1 mm diameter. Gray, 16 gauge 1.7 mm diameter. Yellow, 24 gauge 0.6 mm diameter. Purple, 26 gauge 0.45 mm diameter. External diameter and flow rate. Flow rate depends on the cannula size. Gauge: smaller gauge, higher number, has slower flow rates but is less invasive. Larger gauge, lower number, offers faster fluid infusion. Flow rate example: 24 gauge, yellow 20 ml min. 22 gauge, blue 50 ml min. 18 gauge, green 100 ml min. 14 gauge, orange 250 ml min. Diameter, directly related to the gauge number. Uses of IV cannulas. Fluid resuscitation, for dehydration, shock, or blood loss. Medication administration, for continuous or intermittent drug infusion. Blood transfusion, safe pathway for blood and blood products. Drawing blood samples, for regular monitoring in critically ill patients. Parenteral nutrition, providing essential nutrients to patients who cannot eat. Parts of an IV cannula. Cannula shaft. The main tube, typically made of medical-grade plastic. Needle stylet. A sharp metal needle used to insert the cannula. Harm. The part where the cannula is connected to the foreline. Flashback chamber. A small chamber that shows blood return, confirming vein placement. Wings flanges. Help stabilize the cannula after insertion. Injection port. Allows attachment of additional devices like syringes or IV lines. Steps for IV cannulation. Preparation. Assemble all necessary equipment, cannula, gloves, antiseptic, dressing. Site selection. Choose an appropriate vein, usually in the forearm or hand. Insertion. Insert the needle at a 15 to 30 degree angle. Flashback confirmation. Observe blood return in the flashback chamber. Cannula advancement. Slide the cannula into the vein, then remove the needle. Securing the cannula. Attach the IV line and secure the cannula with tape or a dressing. Testing. Ensure proper placement and patency of the cannula. Complications of IV cannulation. Infiltration or extravasation. Leakage of fluid into surrounding tissues. Phlebitis. Inflammation of the vein. Infection. Risk of bacterial entry. Occlusion. Blockage of the cannula. Hematoma. Bruising or swelling around the insertion site. Key points. IV cannulas are vital for intravenous therapy and fluid management. Size and flow rate depend on clinical requirements. Proper insertion and maintenance can prevent complications.